Well, this is not good, my friends. This is not good. I think I might have to hang up my boots. Hang up your boots. Hang up your boots. If you know who sang that song, put it in the comment section because you, my friend, are the man. Hang up your boots. Hang up your boots. Kids today couldn't stand one song in the pits we had back then. Interesting. So if you know that, put a doobie doo. All right, so let's look at this here. 166 to 197,000 is a new estimate for retirement healthcare costs, and they may be too low. Oh my goodness, what? What is happening? Carrie Hannon, she's a senior columnist with a leading expert, futurist, strategist on careers and jobs, entrepreneurship, personal finance, and retirement. Well, that's a lot of experts there. How do you become an expert in all those things? And she says most Americans, this is writing for Yahoo, all right? And she says, let's see, I think they interviewed her. Well, whatever. Most Americans underestimate their healthcare costs in retirement. Do they? Do we have any evidence of that there, Carrie? Where's your evidence that most Americans underestimate their healthcare costs in retirement? And that's a problem because those future bills may turn out to be considerably higher than you expect. A 65-year-old man in Medicare with a Medigap plan will need to stash away $166,000 for medical expenses to have a good chance of covering his projected healthcare costs in retirement. Oh, you need to stash away. What did she say? Stash away $166,000 if you're a man and 65 to have a good chance of covering your projected healthcare costs. A woman needs $197,000 because she's going to live longer, right? Keep doing it the wrong way. There we go. And those still may be lowball expenses, experts say, underscoring the need for workers to focus either on ways to reduce those costs or to save up more. Yeah. Medicare does not cover all healthcare costs, says Paul Fronston. As a result, many Medicare beneficiaries purchase Medigap or Medicare Advantage plans to offset the donut hole, the gap. The combination of premiums for supplemental college and out-of-pocket expenses can put a huge strain on the finances for Medicare beneficiaries. And yet, what? So here's a source of payment incurred healthcare expenses for ages 65 and older, 2020, source of payment. Well, there's Carrie Hannon right here. There she is. Yeah. Not a fan, Carrie. Not a fan. I don't hate her. I just this is so friggin' silly. So here's a source of payment for incurred healthcare non-institutionalized population for Medicare beneficiaries. Medicare paid, I can't even see what number that is. What does that say? 60%? 60%. Private insurance pays 17%. That's probably going to be your Medicare Advantage. Yeah, maybe a supplement, probably. TRICARE paid whatever that is. Medicaid paid 5%. VA paid 3%. And then out of pocket was who? Was you. Out of pocket. 12% of source of payment for incurred healthcare expenses in 2020. If you're 65 and older, 12% was for you. I mean, I'll tell you where they get these numbers from here in just a second. I mean, it's just, okay. Let me just read you something here real quick from my soon-to-be published book. Jonathan Clements in his Money Guide book from 2016, which is actually a great book. I take shots at Jonathan Clements on occasion, but that book is fantastic. Highly, highly recommend. I don't know if he's got an updated version. I don't know. If I remember, I'll put the link in the show notes so you can buy it, and I get that sweet, sweet 2% Amazon commission. All right, spending on healthcare, financial services, and insurance has soared since for the last 50 years. For instance, healthcare expenditures rose from 5.9% total spending in 1959 to an astonishing 19.7% in 2009. Much of this cost wasn't paid directly by consumers, but rather by private insurers, Medicare, and Medicaid. Yeah, that's 100%. And there we see. Medicare, private insurance, a little bit of Medicaid, and you. So basically between your private insurance and Medicare, that's 77% was covered. You were number 3 at 12. That's just, I'm sorry, dude. That's not that huge of an issue. I mean, you have to have some skin in the game. All right, let's keep going. Let's see. We got limits on Medicare. So the Inflation Reduction Act puts caps on Medicare Part B, Part D prescription drug outlays starting at 25. That's good. So no enrollee will pay more than $2,000 per year. I like it. All right, that will affect 50 million Americans with Medicare Part D. That's for prescription drugs. Good. Now this lady right here, she goes, this is Mary Johnson. Every time we see how bad it is for retirees, we see Mary Johnson. I mean, literally, it's like, I need a quote saying how bad it is. Mary Johnson raises her hand. Call me, whatever this chick's name is, call me. Paying the cost for healthcare is one of the hardest jobs. Not only do retirees need to save enough to replace about 70% of pre-retirement earnings just to live on. Where's that? Where there, Mary? What's her name? Mary Johnson. Where's that? Where are you getting that data set from? Can I tear it apart? Because we've torn that apart 1,000 times a Sunday. So not only do retirees need 70% of their pre-retirement earnings just to live on, but we need to plan carefully for much larger sums once we get older and need more care in addition to just health care. This lady over here, the EBRI says, I'm not the EBRI, but I love Employee Benefits Research Institute. So I haven't read their analysis here, but I will, because I know what's happening here. And I take huge umbrage with their findings, if this is what they're saying. And I know Fidelity does the same study. It's so freaking stupid, dude. All right. We are not wired to think this way, says Mary Johnson. We're not. But then we got EBRI's 2022 Retirement Confidence Survey of 2,600 adults. Over 1 in 4 expect to retire at 70 or beyond, or not at all. Yet the median was 62. So something's going to rise there. Okay. So they're scaring the living bejesus out of people who say you can't retire until you're 70. And then they retire at 62 and they're like, oh, that's pretty good, because they do surveys on retirees and the vast majority of people say they're satisfied. All right, the EBRI projections are wildly conservative, says Melissa Clownhill, who co-founder of the Medicare advice website 65 Inc. Wildly conservative, i.e., they're not. It should be much higher than that. We should scare people even more. This is unfortunately just the tip of the iceberg. We're freaking out in this country because there's this expectation for people that healthcare and retirement is free and should be free. No one thinks that. No one thinks it's free. We all know we have Part B, Part D, and out-of-pocket expenses and a Medigap. No one knows it. No one thinks it's free, Mary Clownhill. But it's not free. It's not going to be. I wish there were a healthcare money tree, but it isn't there. And so to say you only need $166,000 to $197,000 is widely conservative. It's really much more than that, Josh. Let's keep going. Let's see what here. I suggest you fund your significant increases in healthcare. You should start contributing to your HSA, i.e. put more money away so the clowns can manage it for a fee, of course. So add more money, contribute more. Oh, then what else? Working longer. If workers receiving health benefits and a paycheck from their employer choose to work past the 65 and postpone enrolling in Medicare's Part B and D, they will need to have socked away less. Okay, always work longer and save more. Okay, that's great. All right, finally, there's another sizable cost cutter. Relocating for the next chapter. It can vary where you live. Okay, so I want to just share with you something here from my book, which I will link, and then if I link this, I'll link the other book too. You can retire on Social Security. Let's see how many people have. Type in Josh Scanlon books, and I spelled my name wrong. And then we go, right here, 337 reviews. All right, cool. With an average, what's that, 4.25 or something like that? Yay for me. That's actually got more reviews than my tax bomb one. Fantastic. All right, let's take a look here. 337, good. I like it. Let's see what people are saying about your old buddy Josh, shall we? Oops. It was good. All right, let's go to the newest first, most recent. Let's see. Good, says that guy. Okay. Don says, feel better about Social Security. Aram says, very interesting and practical concepts. This is not the first book I bought from this author. I follow you on other networks and you have other channels. Good. It's a printed website. It's just a printed website. It's not a website. It's literally a book. It's just a print. Even contains the underlying URL links. Yeah, because if you have it on Kindle, you can click on it. Okay, 4 to 58. Informative and eye-opening. Like the detailed explanation about how Social Security works. Get this book, says Barbara A. Thanks, Mom. All right. Anyway, so let's keep going. So it's a printed, what? I mean, it's literally not a printed website. It's a book. It's okay. All right, so let's go to the chapter I have on not medical bankruptcy is medical costs are bankrupting America. That's wrong. The truth about medical costs and retirement. All right. Every year, Fidelity releases its study on the cost of healthcare, just like we just read right there. This is from EBRI, so I guess they're getting in the game, I guess. All right, and then we're going to go back to Jonathan Clements, who I already cited here, but this is this other book where he says, and he wrote this at 4:30 a.m. Now, I think he's from the UK, so maybe that's why he wrote so early. But anyway, a 65-year-old couple retiring in 2019 will spend an average of $285,000 in today's dollars on the retirement medical cost. The figure doesn't include long-term care expenses. Ooh. We already talked about, though, insurance pays the vast majority of that. All right. And here we go. And then what does Fidelity tell us? Just like this other lady, is literally just regurgitated shite. To help fill a gap in saving for healthcare expenses, this is what Fidelity says, consider increasing contributions to your tax-advantaged accounts and working longer. Invest more money, work longer. Yeah. Let's keep going here because I think it's interesting. For the record, I take issue with the Fidelity study because of what they don't show. They don't mention that the average retired couple will need over $500,000 for food, or $800,000 for housing, or over $300,000 for transportation. To use a lump sum today to estimate a future annual expense is just silly. You need $500,000 today to cover your food cost. Secondly, why focus solely on healthcare? After all, healthcare is not even close to the biggest expense retirees will face. Well, because no one would take seriously a study or an article that declared the average couple will need $500,000 over the course of their retirement for food. People know they have to pay for food, and that food is a daily cost. So there isn't a fear of the unknown that exists with food like with healthcare. And that's the rub for me. They are preying on people's fear of the unknown. Right. Healthcare is not even in the top 3 expenses for those households over 55. It's only when the household becomes over 75 does it become a top 3 expense. And even then, it's just a tad more expensive than transportation and food, and yet still well below housing. So you should say you need $800,000, the average retired couple, or else I hope you got that stashed away, like that lady said. All right, so let's take a moment to identify how these guys come up with these things. The average 65-plus retiree should expect to spend about $5,000. I'd say about $6,000 now. $5,000 a year on healthcare cost. All right, we got Part B, we got Part D, we got Medigap, or if you're doing Part C, that's fine, and some out-of-pocket costs as well. All right, so we need $5,000 a year, and we're going to basically net that out, net present value, inflated at 5.5%. We're going to say you need for $5,000 a year or $6,000 a year, let's say a 5.5% inflation rate, which is what I use in Right Capital. And we're going to net present value, say over 25 to 30 years of retirement. That will be this $165,000 you need today. Again, why focus on this just one cost though? You need to eat every day, right? How much does that cost? If each meal costs you $5 a meal and you need 3 meals a day, that's going to spend $54.75 a year on food. So why the fear mongering only on healthcare? Well, we just told you. And then what about long-term care costs? Healthcare costs are expensive. You should be worried, and that doesn't include long-term care. The thing is that even Jonathan Clements even says 6% of retirees spend over half their income on medical bills. 6%. That is the point. That is the point. I mean, 94% aren't even spending half their income. In fact, the average is, I think it's like the median is like 12. I think we are talking about 12 or 15. I can't remember. I think it's 12%. So we have 6% are the outliers. They spend a boatload of their money on healthcare costs. Well, it might be because they're in the last 2 years of their life anyway, in the nursing home, where all their money is going to the nursing home. You see what I'm saying? And that's what happens, dudes. As you get older, the last 2 years are where the costs come. We just all know this. It doesn't come when you're 67. if there's going to be significant expenditures, will be the last 2 years of your life. Oh, and lo and behold, the EBRI did us the favor of showing a study where the median cost for healthcare was, hold on a second, I'll find it, for long-term care. Let me find it. The median total out-of-pocket expenses for long-term care, out-of-pocket for long-term care, was at age 70 and beyond was $27,000, with a median annual cost of about $2,000. Out-of-pocket expense about $2,000 median. 50% of the people have more, 50% of the people have less. All right. So again, this is directly from EBRI. For the majority of surveyed people, out-of-pocket healthcare costs, out-of-pocket healthcare expenses are not high as commonly believed. Unlike that lady said, most people underestimate their costs. No, most people overestimate it. For those who die after the age of 95, the median cumulative out-of-pocket expense at age 70 until death is slightly above $27,000. That's if you die at age 95 or beyond. The median is $27,000. All right. It's just with a median annual expenditure out of pocket of $2,000. But the out-of-pocket costs are catastrophic for some. Exactly. Some do have significant catastrophic expenses. The 90th and 95th percentile spend nearly $172,000 or $269,000 on out-of-pocket healthcare costs for those who live beyond 95 and who are in the 90 and 95th percentile. Nursing home expenses are one of the biggest contributors driving the skewness of the distribution. Again, the outliers skew the averages. Without out-of-pocket nursing home expenses, the 90th and 95th percentiles for those who die at age 95 or later drops to nearly 96,000 or 154. Thus, as I say in my book, there is a small minority of folks who have a big out-of-pocket healthcare costs, and the primary reason for such costs are nursing homes. Essentially, if you can stay out of the nursing home, there's a significant reason to believe that your out-of-pocket expenses in retirement will be reasonable. Yep, know what I'm saying? I stand by every single word I said. For all surveyed people, the median, 50% have more, 50% have zero. The median out-of-pocket nursing home expense is zero. Median. Meaning 50% of the entire survey had no out-of-pocket healthcare costs. Nursing home costs, excuse me. Get the book, dude. It'll alleviate a lot of these concerns. More to come, because in my next book I even go deeper because we have more modern knowledge. Because this was written 3 or 4 years ago, dude. If worries about healthcare is keeping you from retiring, you're not doing yourself any favor, because you're actually making yourself more physically ill by staying in a crappy old job with all the stress. Stress is a horrible thing. You got kickback stress, dude, and just sit there on the beach, look at the pretty girls going by, and saying, "Yeah, dude, you got your little." Alcohol-free pina colada. You got your beautiful wife next to you. You don't look at the beautiful girls going by, because you'd be looking at my wife, so don't be doing that. But anyway, you're just sitting there on the beach enjoying life, dude. That's a way to lose the stress and expand your life expectancy. Love your thoughts. We'll see you.